Hello professionals, welcome to our channel Clinical Practice Medicine. Here we discuss the common topics, their management and important practical tips. Today we will discuss gastroesophageal reflux disease and the peptic ulcer disease, which is a very common topic during the practice. What is the ulcer? Ulcer is the break in the mucosa that is more than 5 into the depth to the submucosa. Usually there can be the gastric or the duodenal ulcers. In GERD, that there is a gastric juice, there is a reflux back into the esophagus and leading to injury. Basically, this is a lifestyle disorder which is associated with the stressful lifestyle. It can also be associated with H. pylori infections, NSAID use, obesity, pregnancy, excess eating. There can be a peristaltic esophageal issues that can lead to gastroesophageal reflux disease. There can be a transient LES relaxation, hypotension, anatomical distortion that also can lead to gastroesophageal reflux disease. What are the usual symptoms? The usual symptoms like heartburn. The patient have a central burning pain into the chest, belching, recurrent belching, regurgitation of food, epigastric discomfort, burning. There can also be a dysphagia. Such central pain can mimic the myocardial infarctions. If you want to rule out, you have to do the ECG. The epigastric tenderness would be there. There would be burning. If you get ultrasound, it would be normal. The treatment usually is H2 blockers, that is ranitidine, famotidine. They had to be given twice a day. If you want to use proton pump inhibitors, that is pantoprazole, rabiprazole, lansoprazole, they inhibit the all phases of gastric acid secretion, can be used once or twice a day. When you are using them, you need to understand that it will also lead to the B12, iron and calcium absorption is compromised with them, and the susceptibility to Clostridium difficile will increase. uh, then the antacids are also used. Antacids usually used are the aluminum and the magnesium hydroxide. When there is a pain and the acid is causing the pain and burning into the abdomen, you use this aluminum and magnesium hydroxide. They will give you the instant relief from the pain. When they are accompanied by the oxytocin is usually added into the syrups, which will give you the instant pain relief. And these antacids are avoided in renal failure. The usually the patient also uses eno that contains soda bicarbonate that give you the short duration of relief from the this GERD and ulcer related pains. If you have a documented ulcers, you can use the sucralfate containing syrups that will coat the ulcers and made a physiochemical barrier. The sucralfate is also avoided into the renal failure. So if you have documented H. pylori from the biopsy that H. pylori is present, you can give 14 days of your kit that contains amoxicillin, pentoside and clarithromycin that are given twice a day. In a usual, if you have diagnosed GERD and you want to treat them, what you can do is you can give pantoprazole or rabiprazole. With them you can give the prokinetic, that is domperidone, 30 milligram per day in the morning time, plain pantoprazole or rabiprazole in the evening time. So that will, this prokinesis will decrease the reflux, and the PPI will suppress the acid, so patient will get relief. If still the patient have the symptoms, you can add that antacid what we have discussed, that is aluminum and magnesium hydroxide with oxytocin, and intermittently you can use soda bicarb. If there are documented ulcers, you can use sucralfate. The duration of treatment is very important because it's 8 to 12 weeks, because the ulcers per se will heal from around 8 weeks, they'll heal properly. So to for proper treatment, it will require 8 to 12 weeks of therapy with all these drugs. Then also, if the patient is progressive on the proper dosing of the drugs, if the patient is progressive, patient have constant symptom, you refer them for the upper GI scopy. Upper GI scopy in such patients can show esophagitis, stricture, Barrett's esophagus, hiatus hernia, mass. Then the treatment would differ. So you can refer them if your patients are not responding to this proper dosage and the proper line of drugs. The lifestyle need to be changed, because if even if you treat them for 8 to 12 weeks with the proper dosage, then also the ulcers will get healed, then the new ulcers will happen due to the lifestyle, and the patient will come with the same symptoms after some time. So you need to tell them, if you want to get out of this gastroesophageal reflux disease phenomena, you need to change the lifestyle. So what will they change? They will avoid tea, coffee, alcohol and cigarettes. They had to avoid fatty and sour tomato based diet. They have to avoid spices. They can do a headache elevation during the night time. They have to take the small frequent meals like the 6 times a day, small meals. Do not sleep immediately after eating. That will also increase the reflux. So at least 3 hours gap between the sleep and the eating. Obesity is a risk factor, so you can ask them to reduce the weight. Okay, so if they change this lifestyle, they will be get out of this reflux disease completely. Otherwise, what will happen, you treat them for 8 weeks, they'll get relief. After 6 months or so, they again come up with the same problem. So this slide is very important. You need to tell all the patients this thing, that you need to avoid these things and you need to get out of this lifestyle. One thing you can add here is to avoid NSAIDs, because NSAIDs are also the risk factor. So take home message would be transform the lifestyle. That is very important. Second, total acid suppression by the drugs. Third, the treatment duration is equally important. Fourth, timely referral for upper GI scopy to rule out the other causes. If you have given the good dosage for a good time and still the patient is not responding, just look for the other causes and the answer would be there in the upper GI scopy. So friends, this is about the gastroesophageal reflux disease. Hope you like this video. Please like, share and subscribe, and let us know into the comment box what topics do you want further in this video series of this practical medicine. Thank you.